So now that I've been home for 2 days, I kind of want to make a video that explains how I got where I'm at. So I'm not going to call this like an update video for all the updates, but it pretty much is. It's going to be a video that explains what's happened over the past, I don't know, it's been 8 years at this point that I started having abdominal hernias. So 8 years ago, I had an umbilical hernia, and that hernia was fixed by a doctor called Dr. Fullerton. He used a certain amount of mesh, and he fixed that. Shortly thereafter, I had a vertical sleeve gastrectomy surgery from a different doctor. This doctor's name was Dr. Thamert. And the vertical sleeve gastrectomy caused me to lose a bunch of weight. I lost something like 100 pounds pretty quick. And after that surgery, when you have vertical sleeve, it creates these holes that are called trocars. And one of the trocars had loosened up and created a ventral hernia. So it went from an umbilical hernia, which is lower in your umbilical, and then ventral was a little higher, like under my rib cage. And that hernia was going to need to be repaired because the mesh that was in place from the umbilical hernia was a little mismatched for my size because my mass had gotten smaller. And so then, therefore, that one was a corrective surgery to get all that fixed. So I had A, the umbilical hernia, B, the VSG surgery for gastric, and then C, the third surgery was the fix both hernias surgery. So the third one fixed the hernias, and it created a longer piece of mesh, which you guys have seen well documented in my video series. And both times there were mesh. The third surgery was a 7x3 strip of mesh. And I want to say that happened in 2018. I think it was around 2018. And then over the years, you guys have followed my videos. I talked about, how to poop, how to get out of bed, all this other stuff related to hernias. And sometime around 2019, maybe 2020, but soon thereafter of the third surgery, the repair, I hurt and damaged the mesh surgery that I had done for the last and final repair. It started to slowly open up. I went back to Dr. Thamert, and he showed through scans that the mesh was still in place. The mesh is underneath. You got to realize your mesh is under here. Your fascia is over the mesh. So your mesh is under, think of it as screen, like off of a window. And then fascia is over, think of that as your skin and your tissues and your muscle. And he said the mesh was in place and it was holding all my internals in place, and that it wasn't dangerous. It wasn't great because it caused me a little bit of pain. It caused a little discomfort. It showed bulging out of my abdomen, which looked stupid, but it was still in place. And he said, let's just watch this over the years and see how it goes. And over the years, it's slowly gotten worse. There'll be times when it would be really painful, especially when I would sing songs with my bands and lift certain things. It would be painful, but it would go away. The pain that I felt, I could almost tell that it was tissue being torn. And so in my mind, it was the sutures that were stuck to the mesh that was anchored to my abdominal wall. So my muscles were being ripped away from the mesh, is the way I can envision it. I'm not sure. This is just my speculation, but that's kind of the way it felt. It felt like a very burn type of tear, and it didn't feel like a stabbing. It was a mild stabbing. But anyways, all that's progressed to the point where 2 years ago I had my heart attack, which is also in my video history. And that's when I started having some more stomach issues. But my surgeon, my GI surgeon said, we're not going to do a hernia repair that you just had a heart attack. So we've gone 2 years now, and the heart attack has stabilized, and all my labs and stuff come back good for the heart attack, so we decided to have this repair. So roll back of the clock just a tad. I do a lot of health-related tests and diets and exercise things, and I try all this health stuff because, like most of you guys, I would assume anybody that watches my channel, you guys are in a lifelong endeavor to make yourself better. So I research things online. I look for ways to improve this or ways to fix that. I'm always looking for new supplements or therapies or anything that makes my life better, that makes, me feel better, that extends my lifespan, my health span. So I got to the point where I was on a bunch of supplements because I've been following some biohacking people online. And I had a nice supplement stack, and I wanted to see what my body actually would produce on its own. So I stopped taking virtually every medicine and all my supplements, including my multivitamins and my vitamin D and iron and all that. And this was 2 months ago to wash out. And I did get some pre-surgery labs, but the labs didn't include iron. I couldn't find a source. I couldn't find a lab willing to test iron. But anyways, so I had this surgery, and I had been washed out for 2 months on all of my supplements. I let all of my pre-registration doctor know. Dr. Thamert, I'll let him know. I'll let everybody know. I haven't been taking any of these medicines. And so I go into surgery, and we have the surgery, and the surgery seems fine. I'm really good with anesthesia. I came out of surgery well. You guys saw the video. This is the one from Friday. And I came home, and after I got home, that night I'm recovering. This is post the hernia surgery. And when I get out of bed for the first time, I'm super dizzy because I'm losing blood, because we don't realize that I've got a bleeder and that it's somewhere in my abdomen. This is why you see all the bruising now, and that it is having trouble sealing itself up. I'm not on any blood thinners at this point. I had stopped aspirin. I had stopped my blood pressure medicine, so I shouldn't have low blood pressure as a result of the medicines, but my blood pressure is very low because I'm losing blood internally. Long story short, we get to where we are today. They discover through the labs that my hemoglobin is really low, my iron is really low, my globulin is really low. All of it's low is because basically I stopped taking my iron. And my surgeon said he just didn't realize that. He didn't put 2 and 2 together. And I was like, well, I told you that I stopped taking everything. So I'm back on iron supplementation. I had the infusion of iron at the hospital, and I feel better. I'm not on my aspirin. Sorry, I keep burping because I'm drinking a Dr. Pepper. I'm not on my aspirin, and I'm not on any type of blood pressure medicine right now. I'm just on the carvedilol, which is a beta blocker. It's a mild one. I'm taking it twice a day, once in the morning, once at night. Keeps your heart rhythm steady. And I feel pretty good, but I'm tired. My body's going through massive recovery right now. I took some footage of what my stomach looks like just so that you can see the amount of damage that the invasive part of it's a robotic surgery. It's called the Da Vinci robot. And it creates 5 holes that they go in and they do all this. One of the holes is like air, and one of the holes is like extraction. One of the holes is, manipulation. There's just a lot of holes for different reasons. And it does a lot of internal damage. So now that I'm home, it seems like most of my time is just going around the normal everyday maintenance of keeping myself fed and clean and rested, and all I really want to do is rest. I feel like I'm always tired. My voice sounds weak and it feels weak. I just kind of feel weak. But I wanted to show you what my incisions and all of the bleeding and bruising looks like at this point. If you've been following my channel, this is exactly what it looked like last time, except maybe a little worse. And my wife's filming right now and she's shaking her head. It's worse. So I'll show you real quick. If you want to come down and look at where it all kind of starts, You can point it out if you want to narrate a little bit. She doesn't. So this is, the main one is here. I don't know why they always have to go in the belly button, which I did have. There's a piece of mesh now that's across here and comes up underneath that's bigger than the one before. Did he say exactly how much bigger?
He didn't.
So he just said bigger, and he told me that the tissue that's my abdominal muscles that come down long ways was shredded. They were worse tissue than before. They've gotten damaged. So we had to grab further out into my abdominal muscles here. And he said to do so required a little more area and recruitment, and I needed to keep my binder on, which there's my binder over there, which I'm going to put it right back on as soon as I get done filming. I keep that thing on pretty much 24/7 unless I'm laying on my back or trying to sleep or in the shower. But if I'm on sitting, I still keep it on, but it just loosen it. But it's on very tight because this needs to stay unfucked with so that it can heal. But you can see where all of this bruising just goes. I can't tell how far down. How far down?
Very. All the way right here.
Yeah. Even through the back. And it doesn't feel, it feels much. I mean, the incisions themselves don't look too bad. They're not oozing that bad, except for the one. Which one's oozing?
That one's good.
You think it's going to ooze?
Yeah.
We'll probably have to put a bandage on it, but the majority of these look like they're healing well, and they all have the clear glue on them. And my day is all about getting my pain medicines on time. If I have to coughing, hiccuping, burping, anything that catches your breath. I think that my voice is so weak because I'm finding myself unconsciously not willing to take deep breaths, because the deep breath pushes down on the diaphragm, which used to hurt a lot because of all the internal swelling. But this stuff here, I used to squeeze all of this and it was all just ultra dense, and it's getting looser now. It's starting to break apart. And here's the densest part. But I think mainly this side is the densest because gravity pulls all of the tissue here, and then my body starts to dissipate it. But I mean, I'm just drinking liquids. I'm eating a very soft food-based diet. Like I had egg whites for breakfast with a little bit of mushrooms, a little bit of some protein brownie. I'm going to have some sort of salad for lunch with a little bit of avocado, a little bit of nuts and seeds in that, just some olive oil. And then for dinner, I'll have something like oatmeal, a little bit of protein powder, a little bit of fruit. So very simple foods that are easy to digest. I'm taking Miralax regularly. Bathroom seems to be okay now. Since we got the dam opened up, everything seems to be going better. But I'm just exhausted, resting, and doing the best I can. So there's that. And so I've got the binder on that you guys have seen. I'm wearing it right now. I wear it almost all the time, trying to keep all the sutures in place and let those heal as well as they can heal. I'm eating a very easy to digest diet. Like nothing that I'm eating. I'm not eating any fake meats. I'm eating very soft foods, and drinking a little bit of protein with some of my meals to help heal. And essentially I'm going on aspirin, not taking aspirin at all. It's a blood thinner. I'm going on Advil, acetaminophen, which is Tylenol, both of them over the counter, oxycodone, and Valium. The Valium is the least taken. Oxycodone is semi-regularly for pain, and I'm trying to manage everything through Tylenol and Advil. It's barely manageable because it's painful, but it's better than being at the hospital. I'm glad that I'm home. I hope that I heal up fast enough to be able to go back to work when I'm scheduled to go back, which is Monday. Fingers crossed. We'll see. I was scheduled to have a vasectomy this Friday, which is 2 days from today. It's not going to happen. We've already called and postponed that. And you guys haven't seen footage, of course, but all of that bruising and blood drain has gone south and has basically filled up my scrotum. And my wife can confirm it looks like I've got blue balls, grape nuts, whatever you want to call it, But they look super weird. And I'm sure that my urologist, if he went in there to do the vasectomy, he'd be like, what the fuck's going on here? So that's going to be for another day. I keep having these little coughs like this, and they're painful. They're a knee-jerk reaction. I've got a pillow handy because I'll throw it over my stomach and cough or hiccup or clear my throat or anything like that, because you just got to be super careful. The sutures are very, very weak. They need to heal. They need time. And all that needs to bind together. My muscle tissue needs to form around the mesh so that they bind together and makes it very strong. So I'm going to do the best that I absolutely can to be calm, slow down. My breathing is kind of shallow because of all this. I'm still doing these deep breath exercises on this device to help keep my lungs clear, keep them strong. So I'm doing everything that I can. This is the most current video I've ever made about all my surgeries up to date. So far, so good. I feel optimistic about it. I think I'm going to come out fine. So thank you guys who follow my channel and who have been given thoughts and prayers and have taken the advice that I've given you over the years. I'm thankful that you guys are here. I'm glad that the advice that I've given you has helped you. There's new things that I've discovered, actually. I'll make some shorts on this, but one of my shorts is going to be a better way to cough when you have an abdominal binder, or a better way to sneeze or anything like that. I'm finding some little tricks that might help you guys too. But right now I'm putting ice under the binder. I'm going to put ice and let those, because ice will make vessels squeeze and thin up and bleed less. And then when it gets to the point where I'm no longer on pain medicine, I'll probably put heat, because heat will help break up all of that fibrous tissue and let all that dissipate faster. So I think ice first, heat after. Take care, guys. Thanks for tuning in. We'll see you.